I am still Kelly Salinas. I am still 62 years old, and as you can guess, I still have ALS. Nevertheless, I have had a very nice day. This is my wife, my eternal love, and she talks much clearer and faster than I do. So, April.
I want to thank you also for joining us again for part 2 of our medications video. But before we get started, Kelly and I both would like to thank you so much for all the encouraging comments and posts that we've received, as well as the private questions and comments that we have received through Facebook and Messenger. They encourage us so much to keep going and lift our spirits on days when things get a little overwhelming. So thank you so very much. Please continue to comment and ask questions, and we'll do our very best to answer those questions either in the video format or privately when you send them to us. So let's get started on the medications part. One of the symptoms that Kelly suffers with is excessive saliva, and I always butcher this word. It's sialorrhea. So sialorrhea. I told you I would butcher it. And that's excessive salivation. So that makes it really hard for him to talk, to even eat sometimes, because the saliva just keeps on coming. When he first got it, he carried around a cup and would just spit in a cup, which is kind of a gross thing for him and for anybody else around him as well, but we didn't have a lot of options in the beginning.
Mainly only at home.
Yes, you only did that at home. So he does have medication for that now. We started out trying a drug called atropine, which is like an eye drop container, and you put a couple drops in your mouth, and within about 20 minutes, the liquid in your mouth dries up. So the problem with atropine is it's very hard to control the dose because it's just a drop. At 2 drops, he had pretty good control of the salivation, but if you wanted a little more control and tried for 3 drops, he would be so dry, he literally would be picking his lips up off of his teeth because they would just, he couldn't even speak because he was so dry, his mouth would stick together. And that was pretty miserable for him.
If you have heard of atropine before, it's what your optometrist puts in your eyes to dilate your pupils, but it's also when under your tongue can really dry you out. Too hard for me to control the amount.
So the next thing that we tried was a drug called amitriptyline. You can talk to your physician about that to get the appropriate dose, but Kelly takes 2 of them at night, and it does a pretty good job of controlling the excess saliva. As you can see, when he tries to speak in the videos, sometimes he has to pause to just kind of work the saliva into a place in his mouth where he can actually swallow, but he doesn't have it dripping out of his mouth or anything like that. So we have chosen the amitriptyline route to control the saliva. So if that's an issue for you, do talk to your physician about getting a prescription for that, and hopefully that'll help you. One of the other things that we found through the help of a neighbor was something called mouth coat. And this was when Kelly was dealing with the atropine and his mouth was so dry. So this is the product that we use. You can get it on Amazon, you can get it at some pharmacies, and there's other brands. It's a mouth moisturizer. It's almost a glycerin type of base. It's kind of slippery in his mouth. It doesn't take very much, and it really relieves that dry mouth sensation that he has so that it makes it easier for him to talk and to function. The only downside to this was trying to carry a bottle this size around with us, to church or to the store, any place else, to friend's house.
Airports.
What?
Airports.
Oh, and airports. That was true. We tried to travel. You can't take this on an airplane with you. It's too many ounces. So what we did was we went to Walmart and got one of these little travel atomizers that holds 2 ounces. And this is perfect to slip in a pocket or in my purse, in the glove box of the car. We keep one in the console of the car. So he has one with him all the time without carrying that big bottle around. And we just refill it from the big bottle. And like I said, there's other brands besides Mouth Coat. So you can just look on Amazon or go to your pharmacy and talk to your pharmacist about a product that'll work for you. So another...
I'm sorry. And it doesn't taste bad.
What does it taste like?
I don't recall, but
Oh, I got my cheek. Yeah, it doesn't. It tastes, it's almost a little bit fruity, almost. It doesn't taste bad at all.
no, I'm fruity. You're natty.
One of the other symptoms that Kelly suffers with is PBA. So if you don't know what that is, it's pseudobulbar affect. And it's where you will have uncontrollable bouts of crying or laughter. Kelly will sometimes giggle uncontrollably, but more often than not, he would burst into tears and could not stop crying. Anytime he was moved by something emotionally, something as simple as a grandchild saying, "I love you, Papa," he would burst into tears and he couldn't stop crying. 27.5% of ALS patients suffer with PBA. PBA is not just something that ALS patients suffer with. Neurological conditions like Alzheimer's disease, Parkinson's, MS, and traumatic brain injury also suffer with PBA. There is a medication that'll help for that. It is called Nuedexta, Neudexta. Unfortunately, Nuedexta is incredibly expensive. Kelly's prescription is $1,600 a month. And fortunately, most of the time that he has had ALS, we have been covered by insurance through my employer, and the cost of it has been substantially defrayed. I don't believe Medicare covers that. When we looked at just going on Medicare prescription plan, the Nuedexta wasn't covered. So you'll need to talk to your doctor and look at your insurance company to see if that drug is covered for you. I hope it is, because it's made a world of difference for Kelly. We didn't actually realize how well it worked until we flew to go see a daughter for a grandchild's birthday, and he left his Nuedexta at home.
4 days with Alice made me a believer that simplest things I would have to go sit on the bed and just start sobbing, and maybe 10, 15 minutes.
But Nuedexta
Yeah.
helps a lot, doesn't it?
Now,
Okay.
take this and really smooth it out.
So if that's an issue for you, be sure to talk to your doctor about the possibility of taking Nuedexta to help with those symptoms. Now, with the muscle wasting that happens with this disease, constipation is an issue. And we know it isn't just Kelly. I'm sorry, I know that's kind of a delicate subject. I don't mean to embarrass you. But we've actually had comments and posts, private posts, from other patients that have ALS, and they have the same problem. So we wanted to tell you some of the things that we do to help with that. And one of the first things we started doing was additional fiber. There's Metamucil, there's Benefiber, there's the store brands of those two particular. One is psyllium based, that's what Metamucil is. Benefiber is not, and they both have store brands that are less expensive than those. We choose the Melaleuca Fiberwise. It comes in different flavors, so he gets a different change into his routine, and we're also concerned about any additives that that Kelly would take, and Melaleuca products don't have any harmful additives in them, so that's important to us. So that's the one we choose. You'll need to make a choice for yourself, what works great for you and your family. The other thing that we use, and there doesn't seem to be anything other than this for this, and that's Milk of Magnesia. They do have store brands that are the exact same thing. It tastes nasty. Kelly said this is a cherry flavored chalk. One of the nice things about having a gastric tube is that he can put this through his gastric tube, so he doesn't have to drink it, but it works really well. So Milk of Magnesia is a standby for us. It's always in the bathroom for him.
I want to say something rather serious. Some people and doctors will tell you you don't want to use laxatives for more than 1 or 2 weeks because you will get to the point that you have to have them. Considering the fact I have ALS, this is not anything I will worry about. So I take a therapeutic dose every day.
Okay, so I think that's all the medications we're going to cover today. So we'll cut this video short. Kelly is working on some more videos to share information with you. And again, we thank you so much for joining us. And what did you want to tell them that you forgot to tell them last time?
Subscribe.
That's right.
Like, please subscribe because we really do have some good videos coming up. We realize that symptoms and medication may be a little dry but necessary. I have some really thoughtful things we want to do very soon. In the meantime, may God bless you as much as He has us.
That's right.
Thank you.
I don't have the button. Do you have the button?